Thank you, everyone, for your attendance. And Amy, I'll go and turn things over to you to call the roll.
Sure. Dr. Jones?
Here.
David Thies? Kathy Emanuel? Dr. Reichstack?
Here.
Dr. Vera Weiss? Here. Dr. Peterson?
Here.
Dr. Goodley? Mike Ingram?
Here.
Dr. Hill?
Thank you. The first line item of our agenda is approval of the agenda. Do you have a motion to approve? Dr. Vera Weiss,
Second.
and second by Mike. Any discussion on the agenda? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. I'm moving on to line item D, approval of the minutes for our August 22nd meeting. Does it really seem like we were together that long ago? My goodness. The fall is flying.
Well, and then the next one is 4 months later, so.
It's,
Yeah.
I have a correction to the minutes. The minutes say that last meeting, Mike Ingram approved the August minutes, and I think it was the June minutes that you approved.
we will.
That would make sense.
You need to pay better attention.
You probably did approve the June minutes.
I'm sure. So I'll take that as a motion from Dr. Vera Weiss with that addendum, that
Yes.
change. Do I have a second?
Sure.
Seconded by Mike. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. Our next line item is public participation on our agenda items. Do we have any public participation?
Do we have any public?
That's always the first question.
Okay, moving on to correspondence and communications. Julie?
No.
Nothing? Anyone else have anything you want to share? Mike, anything from the county?
I don't know how much we can talk about the closure of the former Champaign County nursing home. There are some developments happening around that right now. I believe bankruptcy court, is fully fair game for me to talk about,
Sure.
which is where the company, that the predatory company that bought our county nursing home and 2 others and closed them all down. So that should be public record, so I think I could talk about that, but just not the ongoing part. But bank has taken possession of the building and will be trying to recoup their money. And it's possible they'll be looking for somebody who could operate who knows what in there.
Oh, wow.
But there are covenants still on the building, so in theory, maybe they'll be looking for something that fits what the covenants say.
Ooh.
That seems coded enough.
Yeah,
How legal is this getting?
Very. The judge ruled that the bank had to take over, so the company's hands are out of it. And I believe now creditors and things like that, beyond the bank that owns the note, can start going after them for other things too. So, but great company.
Yeah, no, were you on the board at the time that was approved?
At the time of the sale, I was running to try to stop it. And I ran against Patsy Petrie, so that was an unfortunate. They rushed to get it sold. And I think that was one of the reasons that they went with that company, despite multiple people coming from
Rushed
all.
to get it sold before the new board got on.
Yeah,
Okay.
because they were the only bidder at that point. But yeah, and so we bought 3, closed 2, and said that they were all going to just consolidate to that one and then close that one.
Chris, we could probably talk about our county board committee session, so that, and Joe Trotter was there as well, that a county board subcommittee looking at the opioid settlement money was looking for public input. I really think when we went there, we really thought it was going to be kind of a sit down around the table, and it turned out to be a formal county board.
With presentations and slides and all kinds
Yeah,
of.
the whole 9 yards. I talked about a safe consumption site. Joe Trotter did as well. We weren't looking for the money for that. That's going to be a district thing if it I think what really came out of that, the Rantoul deputy made a very good presentation, and I think what may be quite valuable is if you were to look into bolstering the unit in Rantoul with some of that money in.
What,
Staffing.
what's up in Rantoul?
Isn't there a building, public health works with in Rantoul? You could run.
Yeah, we have a building up there.
Yeah,
I
you
mean,
could
we
run
don't own it,
programs out
but
of
we
there.
lease it.
You lease it, yeah.
It
You
has
could run
WIC.
You could possibly run programs out of there with the opioid settlement money, staffing and so on,
For.
overdose prevention.
I see. Is it needed up in Rantoul?
Sounds like it.
Okay.
He made a pretty good, he had seven documented overdoses. They're doing a Narcan, they do Narcan, they've had 3 saves by police officers. And with my experience in terms of treating patients is that there's no lack of,
No.
particularly in Rantoul and then the line down into Houston is a methamphetamine capital as well.
That's unfortunate.
Yeah.
Well, and they asked each of us to make a presentation of how we would utilize the funds and how much funds we would be requesting so that they could then make a determination on whom they would fund, how many they could fund, and obviously they're not gonna be able to fund everybody that was requesting. We followed a presentation on drug court. So one of the judges there gave a pretty great presentation and talked about how they could expand, and then
Drug courts are a good thing.
yeah, police officer was there. We talked about further expansion of the Narcan dispensaries throughout the county.
Is there any need for that? Did Joe talk about that? Because, I mean, they've been out there.
So we talked about, we were talking about some of the rural areas like the Rantools, and then that came up that they were having more of deaths attributed, the 7 that Dr. Peterson was talking about that were attributed there for overdose. The other thing, we got some questions about suspension and administration of Narcan, and whom has to have training for that, and what training's available, what's the liability to the county for that, what's the protection, and those types of things. And so we talked about serving as citizens of community, about what education we do, and how there are all kinds of programs across the area to educate people. I talked about many of these areas have volunteer fire departments who've been educated and trained in these areas because the response times for emergency services can
And
be so
there's
long.
we have little videos, training videos for it too, that people can do on their own. Really simple, especially with the kind.
The committee asked a lot of great questions.
Good.
We were up there longer than I thought we
In
it was about
fact,
25, 30 minutes.
we went up, Joe and we went up together because it's pretty much the same program. The other thing was that the judge had talked about treatment out of jail, but again, it's the Vivitrol thing. And we focused more on methadone and buprenorphine in the jail, starting those therapies in the jail. And I followed up with one of the county board members who represents my district, and she said that if you followed over the last 15 years, Walsh, when he was sheriff, kept treatment going in the jail. If people were in treatment, he kept that treatment going while they were there, but they didn't initiate treatment there. And I think that's still going on, but in terms of initiating treatment, county board members' opinion is that the sheriff is on the substituting one drug for another camp, where it's gonna take some serious education.
Yeah, well, I mean, we can do some serious education, but I always assumed that the issue with not being able to do that in the jail had to do with their medical provider, and I was wondering if there was an outside medical director, for example, maybe somebody who was retired that was working with another agency in town, could they prescribe?
Well,
Because it's.
Yeah, there is a, I think, at one point I was actually looking at taking that contract, but this is a long time ago.
Yeah.
I wouldn't be opposed to it at all, but I don't see why they couldn't consult a provider, get a prescription program, and then dispense it in the jail.
Dispense it like anything else. I don't
Yes.
know, I never understand the
They can do the
hang-up
same
with
thing
this.
with methadone on a daily basis.
Exactly,
Yeah.
exactly. So,
I believe that one of the deaths in the jail several years ago, some of the reports on it said that that a medication had been started prematurely before she was showing signs of withdrawal. And I would have to look that up, but there may be a little piece of that in the lore amongst people at the jail.
And I don't know, yeah, I don't know the specific of that. I remember it just kind of, I do have some kind of a cloud of something happened there. And it may not have been that at all. It may have been the sequela of what they did on the street. The other thing we talked about with that too was that we need to work with the drug court. I think it's worse than I thought it was with respect to accepting medication. On the whole, most of my patients who were on therapy with me were not challenged heavily by drug court, but it wasn't as open as it should be. And most of the referrals were being made to Rosecrans, which has got the contract, and they are non-medication assisted therapy. They have gone to the point where they're detoxing with Suboxone. Buprenorphine is the generic name, but Suboxone everybody knows it as. They're detoxing, but they're not continuing. And if you look at the literature, and I don't know exactly what we'd have to take a look at Champaign. For the most part, we're probably killing more people out of detox centers than would have died on their own on the street.
correct, because as soon as they get out, they overdose. And
they're
same
not
thing with
tolerant.
jail. And so Dr. Peterson, that sounds to me like a good thing to put together a continuum of care for people who use opiates so that we can actually, I mean, everything from the court all the way to, post-care. Court, jail, post-care. So.
Yes, and I've been in contact with Candy. I attended that safe consumption site demonstration in Springfield last month. I really thought that Champaign-Urbana could take something of the lead on that because the folks are so good at it. They have an individual kind of fronting it up there in Chicago who is really quite experienced internationally. I was quite impressed, actually, and I've got his name. And he ended up moving to Chicago for the worst reason, which was he's got a girlfriend there. So now he's working. Now he's working with agencies in Chicago to get one started. But the state law right now proposed House Bill 2 is to fund a demonstration project. And they had set the thing up outside the legislative chamber in the Capitol building. And as I looked at it, I don't think this legislature was in session, so this wasn't heavily attended. But Gateway was also actively involved, which is a big change for Gateway.
I was going to say, that's shocking.
It's a big change for Gateway.
It is, because they were abstinence only.
There's, one drug for another, and we did the old-fashioned way, so the 5% of us that made it, the other 95 can die on the street. Thank you.
Right.
And now that Biden has got China going to quit importing fentanyl precursors, there's no need for us.
forgive me, what I hear you saying is the one drug for another, and that's a barrier to starting in jail. Is what you're trying to express that they have resistance to starting a new medication that's essentially an analog that now works?
They have resistance to doing medication-assisted therapy, which chiefly is methadone or buprenorphine. And this resistance comes from stigma, really over years. And part of it was as a profession, was our own fault, because we called it opioid substitution therapy, which was stupid. Now we call it medication assisted
Like us
therapy.
calling, the public health calling HPV vaccine genital,
Correct.
Right.
instead of a cancer vaccine
Right.
like they did in Australia, yeah,
Right.
same thing. It
So-
happens.
Because I feel like that's a giant missed opportunity.
Oh, it's huge.
Yeah.
Yeah.
15 times the death rate on discharge from jail.
And that's something though that I didn't even know that was an issue. I had no idea until you just said that was maybe where the barrier was. I just assumed it had to do with their medical provider, the contracted medical provider. So if that's the issue, that's something we can work with. I mean, because we can certainly educate people on how that works. And, nobody, what always just amazes me, nobody has any issue with sending somebody out of, traditional treatment for alcohol or crack or anything else with a handful of SSRIs or other drugs. Nobody says a damn thing about that, that's normal. But when you try to do the other, it's like somehow that one's, that's a bad one. And it just doesn't make any sense to me.
Well, the truth of the matter is that people on therapy, both methadone, buprenorphine, certainly naltrexone, which is Vivitrol, are not high
No.
after they become tolerant and stable on the meds. They really are not high at all. Methadone you can probably push to an extent to get a little buzz there, but buprenorphine you can't. You can't push it to get a real buzz unless you're really opioid naive. And these folks that we're treating are not
No, they're
opioid
not.
naive.
They would never go on it if they
Right.
were. They would never.
I started a guy, I mentioned Coles County there because that is a cesspool for attitudes. Both if you are a woman who ends up having an opioid positive urine, your kid is taken away from you for sure.
Oh my God.
I treated a guy coming out of drug court in Coles County who was doing 4 grams IV heroin a day, and this was relatively pure. This was at the Chicago level. I was able to stabilize him. We got him to the point where he was on. I really started him on a huge dose of drugs, and people will look at me and say, "Boy, this is dangerous." No, 4 grams of heroin isn't dangerous, huh?
Right.
We got him down to a FDA-approved level, which I thought was impossible, but Coles was pushing him, and then they pushed him to get off. And he relapsed. And now he's in prison. He was running a roofing construction company. This is just ridiculous.
It is. Yeah. I had Coles County, was in my HIV region, so, tell me anything. It was the same thing with all that.
All that, yeah.
Yeah. Our condoms were actually encouraging people to have sex.
We'll follow him. Yeah.
It's tricky.
Something for you to work on here. Thank you very much. The next item on our agenda is the Smile Healthy. We have reports for July, August, and September. I would entertain a motion, if you would so choose, to do all those together. Moved by Linda, seconded by Dr. Vera Weiss. Any discussion?
And the only thing I have about the reports is, have we mingled the district and the county board?
No.
Is that the same report?
No.
It is
They,
not.
no, they have their own reports. And our dental reports, you guys don't get our dental reports because they're online. Are they still online? Yeah. So you can get them You can look at ours online, but you don't see ours because you don't fund that program.
Oh, no,
so
I'm
you
not,
don't get it,
what I'm
but-
talking about is the Smile Healthy, because it's got Champaign-Urbana numbers, and then it's got Boyd.
Yeah, That's
And
a-
so that looks commingled,
oh, I see what you're saying.
yeah.
No, that's people that they're seeing. Are you asking them if there are clients too? That I don't know.
Right,
That
I
would-
don't-
That would, I don't even know how we would do that, but,
We're funding outside of Champaign-Urbana.
correct.
Right, and I believe the reason that we have the zip codes on those reports is partly to make it easier to separate out those that are in the cities, and the county.
I don't think the totals are separated out though.
I don't think so, but it's an approximation. Because I was raising the question about, is enough of our money appropriate for the children that are outside of the county?
And what's the answer you got to that?
It looked like it was more than appropriate. That we were getting more than the bang for our buck.
Okay, so, but they are treating Champaign-Urbana residents as well in that program that we're funding.
Yes.
Well,
You're not.
Do you want me to comment?
no, I think what, oh, I see what you're saying. I think what you guys are getting from them on the report, correct me if I'm wrong here, is everybody that Francis Nelson is treating, correct, or Smile Healthy?
Yeah, and then my understanding is the idea is that you're funding a portion because about 30% of the patients are from outside of Champaign-Urbana. So that the funding support is for the portion of the patients that are outside of Champaign-Urbana.
Yeah, but they're just including everybody that they treat there. You probably have other zip codes from outside the county too, don't you, or do you? I don't even know.
Not a lot.
Okay. But, yeah,
The breakdown would be helpful in making sure that our proportion is correct then.
Okay, we can work on that.
No, is that what that's what I'm asking though, is it helpful that it's broken out like that so that we can see, oh, we're funding 30% of this and.
That's my understanding, and I've only been here 2 years, and we just kind of picked up with the reporting that had always been done. So if there's more clarity in different reporting, we're kind of happy to modify.
I think that what you're getting is probably their, you might not even know this, but I think that how they have always done it is showing, basically you're showing all, are you showing all the kid?
Yeah.
Yeah, they're showing all of the child dental appointments. And then the part you're funding are the ones outside of the CU zip code. I assume the ones in the CU zip code have Medicaid and they're being funded by
And
it.
that would be good to get that clarified. I don't want to kill the program, but of course you're getting third-party payments too.
We are, but we also serve uninsured
Right.
too.
Yeah. So I mean, so the program is bigger than just, we're getting the financial aspects of the program are larger than just what we're funding.
They are.
Yeah, because Whitney, what does ours cost to run a year, the dental? Do you remember? I know that we.
A lot.
I can tell you,
Right.
I can tell you that several years ago, we were putting in $1 million in tax dollars into the dental program.
We're not doing that anymore.
We are not doing that anymore because we have gotten the Medicaid, you know, we've gotten Medicaid, we get the other money from that, and it's way better, way better.
We also don't see anybody with private insurance.
Correct, we don't see anybody with private
Even in
insurance,
schools.
And revenue doesn't really cover costs, or it barely covers costs, and there seems to be unlimited need.
Well, it's a much better program when it became part of Francis Nelson than it was before, which was trying to induce some 6 dentists is all they could get in town that would agree to take a reduced fee of 50%,
That just
usually
didn't-
customer.
That just,
And, you know, and they get
didn't work.
it treated about, 18 a month, and this is much better program.
Oh, yeah.
They talked about that, making you part of Francis Nelson, because Francis Nelson gets much better reimbursement if they are on Medicaid. They get 3 times the level of reimbursement than a private dentist gets. And that's to cover the uninsured. And that starts to get, you talk about 75% usual and customary.
Yeah, and we've also really worked, I'm sure you guys are doing it too, to make sure that kids are covered, because they can all be covered.
Yeah.
And so we're getting them, we're making sure that their families are getting the insurance, because it's not just about getting the dental bill paid. If you're on Medicaid, you're gonna get other stuff paid. So it's been a 5-year, 6-year, longer education process with working with families to get them hooked up, to get them signed up for insurance. So there should be rare kids that don't have insurance, and those would often be kids who are just brand new to the community, brand new to the country maybe, brand new to the,
Mhm.
We see that quite a bit.
and we see them. We of course will see them. And
Try to get
then
them
try
in
to get them
school,
hooked
yeah.
up.
We'll see them in the school for school seal program services, and then get them hooked up to our clinic. Once they're insured, and then they can get more extensive dental care in the clinic treatment.
There are also services provided at WIC centers both to children and to pregnant moms. I don't remember whether our funding for that part of the program is covered in the Smile Healthy grant, or whether it's just kind of,
You mean like the fluoride treatments for the babies and things?
I'm sorry.
You mean the fluoride treatments for the babies? What do they call that?
Yes, and also the evaluation and the education.
So.
That's with them, not here. I mean, we do it with WIC, or I don't know if we still do it, but we,
Oh, not the varnish anymore, but.
yeah, we used to yank out all the little babies and do the varnish, the little fluoride varnishes on them.
Right, and doing it for the mothers also decreases the prematurity rate with the deliveries. So it's,
Yeah, I don't think we do that.
We did pre-COVID, but we haven't.
Yeah, we did do that, we did.
We had a grant to do it.
Yes.
And we did it in the schools, and we're working on getting it up post-COVID going again. There's a few different barriers. But we want to, and the schools that we went to were outside of Champaign-Urbana.
thank you.
You're welcome.
You ready for me to call? So we have moved and seconded for the
You didn't
monthly
expect that,
reports
did you?
for July, August, and September. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. Next, we have the invoices payable to the Champaign County Administrative Services for Child Dental Access Program for the months of July, August, and September. So the same, we can entertain to do all of those in one motion, or we can break them out separately if you would like to discuss them separately.
I'll move we pay all of them.
Moved and seconded. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. And then that takes us to the Promise Health Dental Staff Recruitment Project update. So we had asked the last time in August for Seth to come back and talk about some of the funding that we're providing, where that funding is going in terms of the recruitment of dental staff.
Yes, so, for, this year we awarded, I think there were some questions. Hillary was here last time. She's our newer dental manager. I don't know if she was able to answer, but there were questions about, the money was used for sign-on bonuses, as well as some of the recruitment costs, for dental staff. Previously, like when I started, we were down to no dentists. Right now, with new ones that are coming on, we should have 5.5. We're adding opportunities at Francis Nelson, trying to add some at another one at Urbana, School 2, and we're trying to get our Kirby site up, that right now we'll have dental there. There's been some issues with licensing and Medicaid, with, the impact and HFS getting registered, so we don't have those things up as quickly as we'd like. But I think right now, we should, or soon at least, we should have about 13 functioning operatories. We're also looking, some of the new people that we've recruited or working on recruiting will do extended hours so we can use, limit, so we can get more use of the operatories that we'll have. And I think there was a question, so we had requested, and I think that you approved $25,000 to help next year to recruit, and I think there were questions about, are you guys gonna be recruiting forever? And it kind of seems like it, but for the past year at least, the dentists that we have recruited have stayed. We've given them initial sign-in bonuses. They also, I think most of them get National Health Service Corps loan repayment as well. It might seem we still are recruiting, so the funds for next year will help us recruit dental staff, dentists, and dental hygienists. And we really appreciate it. It might seem like we are going to be recruiting forever. It probably won't happen next year, but we're opening our school community health center at Rantoul at JW Ader campus. We're super excited about it.
That's exciting.
I think we'll have some opening events and things that everyone will be invited to probably after the first of the year, but December 11th we're opening. And then eventually it's a really great space and they're really great to work with, so we're planning on adding dental there, and there's a huge need for dental and behavioral health and medical, so.
I will say that JW Ader, the school nurse there and their staff, they are kind of a dream to work with.
They are a dream to work with.
They're very, very good, easy to communicate with. They're very cooperative. In fact, not this school year, but next school year, our mobile health clinic and the Dr. Ben Robbins asthma clinic will be parking a virtual health station in the school with bi-directional consents, so that we can do follow-up asthma visits virtually so the parents don't have to take off work. They can just do it with the school nurse, and it's actually a really slick system because the nurse can put the stethoscope on the child's chest, and the pulmonologist in our clinic in Urbana can hear the lung sounds, like, and that's how sophisticated the virtual health stuff
That's
is.
awesome.
But they I feel like are a leader in the community at connecting, school health with the professionals that can help their work, so.
They only have 2 kids. There's a nonprofit, I think, looking into that has made a Freedom of Information request, but Rantoul, looking at all of the schools, I think they only have 2, and they have plans for those kids to get in, but 2 that were outstanding being excluded from school for not having the required exam, the immunizations and things. That's, given the size, that's a huge thing. So we were really excited about working with them, but we're gonna continue to recruit dental staff for a while. But we are really appreciative of your support.
Any questions, anyone else? Thank you very much for your report. Thank you for your time.
You're welcome, thank you. I have to scoot to another meeting.
We have to speak to some food, so let's get moving. Just kidding. You know how I am with my feeding times, but all.
The time change.
Yeah,
Oh, no.
Next line item, under H, CUPHD, approval of CUPHD invoices. To place those on file, we have those for July, August, and September. Same, do we want to entertain a motion to do all of those items together? Moved by Dr. Goodley, second by Mike. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. Now, as we've discussed previously, anytime the county's entering into a contractual relationship for any grants, we need to discuss those, review those, and we need to approve those. We have 3 of those on our agenda this evening. The first is the Public Health Emergency Preparedness Build and Sustain Emergency Preparedness Capabilities from July 1 to June 30th in the amount of $62,726. And that is in your packet, well, sent to you, and items, pages 34 to 85.
And the first two are ones that we have every year forever. It's the third one that's the different one. It's the kind of exciting one.
Would you entertain a motion to accept all three?
We can certainly do so, so that we have to, I know, document each one individually. So the second one would be the Comprehensive Health Protection Grant from July 1 to June 30th in the amount of $207,263.50. And the third one being Strengthening Illinois Public Health Administration from July 1 to 2023, November 30th, 2027, in the amount of $350,000. And maybe Julie, you want to
Yeah,
speak?
Julie discussed that,
Yeah.
that one
Yeah,
prior to
I
the
didn't know if there's
commercial
anything you wanted
break.
to add.
Yeah, I'll just give you a brief overview because not everyone was here. The SIPA grant, the Strengthening Illinois Public Health Administration grant, is really unusual. I've been in public health for almost 30 years and I've never seen anything like it. It is literally a grant from the state for agencies, public health, because we're hemorrhaging staff everywhere. They're retention grants. So they are actually, it's a grant to give staff retention grants and come up with a retention plan, different kind of things like that. We've come up with one. It was approved by our board Monday night. And then we'll take the details of it, you know, like, because we want to do this by December. Can I talk about this? And I know we haven't announced it to staff. I'm just trying to check with you guys.
This is a public meeting, so
Yeah.
probably not.
Well, I mean, I guess I can. It's just that we haven't announced it to staff yet. But what it is that if people are here for 3 years, they get $2,000. I have to keep looking at you guys. If they're here for 7 years, they get $3,000 more. So we have staff that'll be getting $5,000 in December, which is amazing. And then we're going to have then the 10-year, and we looked at this because, when I say we, it wasn't me, but looked at the data to show that there's a big problem. After 3 years, you get a lot of people flake off and go other places. So the idea is that they get this bonus at 3 years, and then they know that another one's coming, a bigger one, at 7 years, and then the next big thing is at 10 years, and that's when they are vested in IMRF, which is the real big deal.
Yeah.
Or we try. It's easier to sell that to older people than it is the young ones. They just can't comprehend that sometimes. That's an important thing. You want that.
Yeah, that's a big deal. It is a big
It's a
deal.
big deal, but these
understand.
younger people, it's really different. I know I sound like the boomer I am, but it's just, they don't
Well,
get
see,
it.
by the time you get to be 30, you're elderly.
Right, right. So, I mean, it's really hard to get it, but so we are ecstatic. It's a grant that'll last out for 4 years, and then what we're really working on is having our agency continue that moving forward. Because of course, the initial cost is gonna be at the beginning. And then we plan to keep doing that after that. So it's exciting. We've never had anything like that, and we just haven't announced it to staff yet. We're working on the email that's gonna get sent out before too long. Is it this week?
Well, we wanna make sure it gets approved.
Whitney
by
takes the
both-
notes in our meeting, that's why I have to keep looking at it.
So we wanna make sure it gets approved by both governing bodies
Yeah.
before we announce it to staff.
Although you won't approve necessarily the details, which I just told you, but our board has to. But
And this is in
It's all
addition
coming
to,
in.
what is the district getting? What is the,
about the same as in, I think the entire thing is like 750 or maybe it's 775,000.
it really is unusual.
It's beyond unusual. I've never seen anything like it, and it's all over the state. And what I had said earlier, which I find heartbreaking, is that a lot of the places that are not accepting them are not accepting it because the county boards won't let them accept it. They don't want them to keep public health staff because they don't want public health.
And is that next door, Vermillion? Is that true?
I don't honestly know who all of them are, but I know that there are some that didn't accept them. They did not accept them. So I'm like, we'll accept them.
Yeah, we'll take.
And in the past, and sickeningly enough, that has happened in the past. You know that we've gotten those huge grants for marketing. We got such huge grants because other places wouldn't take the money. So we're like, we'll take that, we can handle that. Yeah, it's just crazy, but we are always poised to accept funding.
You know what to do with money?
We do, we're always poised to accept that, so, anyway, it's very exciting, and staff don't know about it yet, and it's going to be one of the neater emails I will ever have gotten to send, I think, because not all of mine are exciting.
Put a Santa Claus on it.
Oh, right. because
And
you
they're
said
gonna
the
get it in
first
December.
Disbursements will go in December. That's
First
very-
disbursements will
yeah,
go in
even better.
December.
That's really cool.
So that means some people in December will be getting 5,000, some will be getting 2. Some will not be getting anything, some will be getting 2 in December, and then maybe 3 in January, because there are a couple people who are like right on the cusp, which is kind of cool. So they'll be getting one in 1 year and one right in the next year.
And they're not expecting this at all.
No, they don't have any
They don't
idea
know
it's coming.
anything about
No,
it.
they don't know it's coming, so it's going to be a big
This is
deal.
being televised, isn't it?
I know, well, yeah.
I'm actually live tweeting right now, so.
Yeah, no, I mean, so it's gonna be, now, of course, we, not to get into the weeds too much, but, we're in the middle, I don't even know if you know this, but we're in the middle of a collective bargaining agreement process, so that is gonna have to be postponed, or whatever you say. I don't know. It has to be bargained for, which, so it's not gonna be everybody that gets it, but everybody that's not in the bargaining unit will be eligible for it right off the bat. And that's still a good, that's all the coordinators for sure, and there's a lot of them.
And as you said before, this is just the county piece of the portion, so.
Yeah, it's
this-
like
this
700.
covers, yeah, the percentage that each employee has for county activities, and then you still have
It's-
the one for the district too.
Oh, yeah,
right?
it's the whole thing.
So you
But we're
can
just doing one.
Yeah, it's one,
Yeah.
because all the staff are district, they're district staff, but you know how that works.
Split time.
Yeah.
They
No, I
split
was-
time.
Yeah, I was just saying, like, you take both the percentages, though, that allows you to keep it sustainable, because you'll have 2 different pots for it to
Yep.
come from. So just
And-
kind of point that out for everybody.
And then, like I said, the plan is that the agency then, that becomes the norm after this grant ends. And the grant lasts for 4 years, which is nice. Because sometimes they'll give us some weird money and you have like a month to spend it. That's not good. But this is never, it wasn't expected. So, kind of exciting.
So we, oh, go ahead, I'm sorry.
Yeah, so if somebody's been here for, say, 10 years, will they get the 10-year grant?
There is no 10-year
No, there's
grant.
not.
They would get the 7-year grant.
Okay.
But then they don't get the 10-year, the thing, so it used to be 8 years, but now it's 10 years. So the 10-year thing is, if you stay from 7 to 10 years, once you get to 10, you're vested.
Okay, so if
And then,
somebody,
by then you're so beat down that you just would stay. You're just like,
No,
"Oh,
you want
fine,
to
I'll just
anyway."
retire from here. I'll just retire from here, that's the
how it feels, Sarah?
Oh, wait, that's.
Sometimes,
yeah. Sarah and I can both speak to that.
That's
Amy's
right.
getting close to being able to speak to that.
Correct.
but somebody who's been here 8 years, say,
Mhm.
they get the grants from 5 years and 2 years it's incorporated in it?
Yeah, they would get the 5,000.
Great, okay.
And then you just wait, then they have the 2 years to wait until they get to vested. And we're really going to be trying to explain that to them, how much of a benefit that is, because it really is. I mean, to work at this agency, not only do you get the retirement, the pension, the IMRF pension, we also have a 457 plan, which is like a 401k plan, but for units of government, and then we also, we also pay Social Security. So, yeah. So it's a good thing. It's just hard when you're young to
To
look at
realize
that,
that, yeah.
but that's,
Visualize
to
that.
visualize that.
Not that these old people beat me
What,
down and all
what
that.
I need to do is drag the pictures of myself out when I started and be like, this was me.
I think I have some of those pictures.
Well, you do have some of those pictures.
We look so young.
You look the same.
Yo,
The rationale for the state doing this, is it because of the problem with getting people to work in?
Correct. So it's for recruitment and retention. Recruitment's not really so much of an issue with it, but retention is, and especially It is, and some jobs especially. I mean, for some certain jobs, we're kind of like a little training ground. You can come in here, you get your initial experience, and you get your licensure, and then you're out. And so, you know, we have to be able to offer some things. So that's kind of cool.
We have a motion and second to entertain all those together. So Dr. Peterson, I believe you motion, and second, just want to make sure.
Call me.
Okay, just want to make sure, I heard someone say it, but I know which way. Okay, so seconded by Mike. Any further discussion? Hearing none, all those in favor? Aye. Anyone opposed? Any abstentions? All of those grants have been approved and passed. Line items 5 and 6 have to do with the reportable disease and performance management reports. I would entertain a motion to place those on file. Entertain both of those together. Dr. Vera Weiss, Dr. Goodley.
I have just one thing on that. I had no trouble opening the disease, reportable diseases, but when I got the performance management, it said I need a password.
Oh, it's, the issue with that is we're in the process of redoing that, so we'll get, and I don't think it's password, it shouldn't be password protected. Maybe it's just because they're messing with it. I'll check on that.
Okay. I don't think I recall exactly what's in there.
I don't remember us having anything password protected. We shouldn't. Would that be right?
So on the
Would that be-
reportable diseases, I
Okay.
mean, there's not much going on except gonorrhea and chlamydia.
Always,
Yeah.
always.
Having no lack of that, apparently.
No lack of that. You know what is going up though is congenital syphilis. Or
Didn't see any cases on that.
what?
I didn't see any.
Not here.
Oh,
Danville.
not here. Oh,
Oh,
it's
Dr.
not in
Peterson
Champaign-Urbana.
That's not
No.
true. That's actually not true. I do think, of course, ours are a little iffy sometimes because, you know, of Carl and OSF, see people from all over, but I don't think we've had one that was our client. I'm not sure. I don't think so. Not in the county, but
Yeah,
it's
pretty
going up
often.
everywhere, and that just tells you that women are not getting prenatal care. That's all that says.
Yeah, that's what that means.
That's
yeah.
what that means. Yeah.
I just tried and it asked me for a username and password.
Oh, all right, well, I'll find out what that's about. Okay.
Okay, moved and seconded. Any further discussion? All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. Our next line item is an update on the sexual education program in Champaign County Schools.
Yay, my turn. We're rolling in the school year now. We're almost to the first semester being over. So we're in JW Integrated Tool, Fisher High School, and Fisher Junior High. We will be in both of those schools again in second semester. The only school that we're having, I don't want to say issues, but just a little hiccup, is Ludlow, actually. We reached out to their student services coordinator because they had been interested in having sexual health education previously. So we just revisited that conversation. The school services coordinator was interested and took it to their school board. School board said that they were not interested. So we weren't able to get into Ludlow at this point, but we have capacity and we'd love to sneak in there anytime we can. They're small enough that we could do, you know, a couple weeks there. So we're kind of hoping for second semester to sneak in there. If anybody has any pull in Ludlow.
With your board.
That's too bad, because that's,
Yeah, you always gotta worry about the school board not being happy about it.
Yeah.
The person really needs to worry about that is the superintendent.
it's but the school could really use that.
Yeah.
And we've done it there before and kids have been really receptive to it.
Thank you.
Yeah, no problem.
Next line item on our agenda, under old business, was an update on the long-term care beds in Champaign County. I know Kathy was not able to be with us this evening. I did email and ask if she had anything she wanted for me to share. Unfortunately, I didn't hear anything back, so I don't know if anyone has anything to share or has heard anything more in regards to that funding that was provided towards, I know, putting together some initiatives.
I just know that it's we've kind of gotten to a point with that group, because there's a group kind of advising, that we need to say, I need to tell them, let the people who design the surveys design the survey, and let's get moving, because we're still working on the survey, and they're still constantly back and forth on it. And that you don't really want to design a survey with a whole big group of people. That's not really the way to do it. But we kind of sent the thing out and said, let's get moving on this, because, you know, that's already, this amount of time that's been spent on it has really already eaten up about half the money. So, I mean, we need to get moving, because we need to get the data collected and the analysis done, so.
And then the county nursing home, or what it used to be, is now in bankruptcy.
Yeah.
I'd keep an eye on some news from that.
Mhm.
Thank you. Any other questions? Approval of our 2024 meeting schedule. So, very last item on your packets or online that you're looking at there in monthly meetings. The meeting for spring is currently set at March 19th, summer June 18th, and then August 20th, that'll be our budget meeting, and then November 19th. So I don't know if anybody wanted to take.
Those are all
a look.
Tuesdays.
Yes, so to see if there were any potential conflicts that anyone had with any of those. I know.
Yeah, oh yeah, I
It's
can tell
kinda-
right off the bat.
I know, it's poor thinking, I understand, but, some people may know that there are some potential conflicts already, so I'm just putting it out there of, you know, conferences, meetings, other kinds of things, but, March 19th is outside of the UIUC spring break, so sometimes that's been a conflict in the past for people working with campus. So that would be the alternative week to that. But hearing no issues with March 19th, we'll keep that one, okay? Anything with June 18th? We're all okay with it?
Are we still doing it on a Tuesday night?
Yeah, that June 18th is still a Tuesday evening. Are those still good? That's been what we've done in the past, but if, you know, we need to look at an alternative, we can do that as well.
Well, these things usually come up when we get close to it.
I know, and we need to do something then, but I thought I would go one by one just in case. August 20th, that's usually the first week, that usually works out pretty well. Anybody have any issues with August 20th that they're aware of currently? And then November 19th will take us to the week before the holiday. So that's traditionally worked well for us in the past, and APHA next year is the end of October. So that would be I know I had a conflict for a conference last week, but hearing none, then I guess we need a motion to approve the meeting schedule for next calendar year 2024. So moved by Dr. Vera Weiss, do I have a second?
Just look at Mike.
I'm looking both ways. I'm looking at everybody.
Actually, if any, so your county board schedule is free on Tuesdays, or?
No, but this is usually, the dates for these usually line up for the week that we have a full county board meeting on Thursday. So the committee of the whole is usually on the second Tuesday, and this is usually on the third Tuesday, from what I was looking at. So it's like when it gets rescheduled, sometimes there was that night that I had to like run from here to another meeting, just because this got rescheduled to a different day. But
Moved and seconded, all those in favor? Aye. Anyone opposed? Any abstentions? Any public participation on non-agenda items?
Dr. Eustak, what are on your socks?
Grogu. Maybe.
Jealous, I thought that's what I was looking at. Jealous. Okay, that was public participation. You love it, grow you socks.
All right, our next meeting is March 19th, 2024 at 5 p.m. Yes,
Do you want to talk about the paper versus electronic real quick?
oh, yes, thank you so much. We decided 2 meetings ago to not send out the packets, and I just wanted to just ask again if that's still working okay with everyone, just to get the information electronically instead of the packets going out. Everybody still okay with that?
Yeah, the only time I really want the hard copy is when we have those giant budget pages.
The budget meeting, August, okay. So
Yeah,
we'll say
that's
for the
right, you
August
can't
meeting.
print those.
Those were nice.
Yeah, okay. So we'll say August meeting, yes, other meetings, we're okay. Thank
Is
you.
the-
Are you on the
Motion
net
to
here?
Oh, I was also.
Oh, no, they're all right.
Just
Okay.
just before we adjourn, speaking of the county board calendar,
Because
that
I'm
will
thinking
be my last meeting on this board.
Just download that.
I'm resigning from the
That
county board.
on my iPad.
Oh.
So, just FYI.
Oh, I'm so sorry to
The
hear
person
that.
who's replacing me, in theory, we have to go through the whole process, but I did find somebody who I was looking to fill my seat. She used to work at Champaign Nursing Home, so I figured maybe she'll have some insight if she ends up being appointed to this board as well. But we do have to go through the selection process. Everybody has a chance to apply to it, and
Oh, I bet they just fight over it.
well, that's the thing, is that sometimes if the person leaving doesn't find somebody, nobody applies, but then
Well, Mike,
sometimes.
you've been a very big improvement
Yes,
over
yes,
the
thank you.
appointments
It's
that
been-
we've been used to.
This has been, yeah.
I appreciate that. I wish I could stay, honestly, but yeah, it's been something I've been working on for a while, and I think she's gonna be a really great board member, assuming it's her, so. But thank you for that compliment.
Thank you for your service.
Thank you.
so much.
Can I keep this? Motion to adjourn, please.
Motion
We'll get to find another
Seconded by Dr. Vera Weiss, moved and seconded. All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you all
That's
so
so
much.
Maybe it was.
All right, we'll see you in a while.
Maybe we
I don't have to ever do that. I never know how anybody